Today we're diving into something that is, without a doubt, one of the most important skills you could ever learn: how to perform CPR on a child or an infant. This is the kind of knowledge that can turn a moment of pure panic into life-saving action. So, let's get right into it.
It's a question that sends a chill down your spine, right? Nobody wants to even think about it. But emergencies don't wait for us to be ready. So in the next few minutes, we're going to walk through the exact steps so you can turn that feeling of what if into I know what to do.
You know, seeing a child who's unresponsive is one of the most terrifying things you can imagine. The goal here is to give you a clear, calm plan, because knowing exactly what to do step by step is the single best way to cut through that fear and actually do something that matters.
Okay, so before you even think about starting chest compressions or rescue breaths, there's a critical sequence of events that has to happen first. Think of these as the foundation. They set the stage for everything that follows and make sure that professional help is already on its way.
It's a really simple three-part checklist. First, look around. Is the area safe for you and the child? Yes? Okay. Next, check if they're responsive. If you get nothing, immediately yell for help. You want to get anyone and everyone's attention. Then, you or someone else needs to call 911 right away. Seriously, do not delay that call.
And that check for a response, it has to be lightning fast. We use what's called the shout, tap, shout method. You shout their name, you tap their shoulder, or for an infant, the bottom of their foot, and you shout their name again. The whole thing should take no more than 10 seconds. Time is everything here.
Now this slide is a fantastic cheat sheet. Just look at the key differences between CPR for a child and for an infant. Everything's different. The hand technique, how deep you press, even how you open their airway. This really drives home a critical point. A child is not just a small adult, and an infant is definitely not just a smaller child. So let's break down exactly what these differences mean in practice.
All right, let's start with child CPR. We're talking about anyone from age 1 all the way up to the first signs of puberty. The name of the game is effective compressions and breaths that are tailored specifically to a child's body.
First things first, where is the child? They absolutely have to be on their back on a firm, flat surface. A bed or a couch might seem convenient, but they're way too soft. They'll just absorb all the force from your compressions, making them useless. The floor is really your best bet.
So for a child, you're going to take the heel of one of your hands and place it right in the center of their chest, right on the breastbone. If you feel like you need a bit more power, you can place your other hand right on top of the first. For a smaller child, though, one hand is probably all you'll need.
Now the rhythm, this is so important. You need to push at a rate of 100 to 120 compressions every minute. The absolute easiest trick to remember this is to think of a song with that tempo. The classic is Staying Alive by the Bee Gees. I know, it sounds a little weird, but trust me, it works perfectly.
And as you're keeping that fast pace, you also need to push down about 2 inches deep. That depth is what it takes to actually move blood through their body. But just as important as pushing down is coming all the way back up. You have to let the chest fully recoil. That's what lets the heart fill back up with blood before the next push.
Okay, so after 30 compressions, it's time for 2 breaths. For a child, you'll use the head tilt/chin lift. Just gently tilt their head back so their nose is pointing a little bit toward the ceiling. We call this a slightly past neutral position. It's a small movement, but it does something huge. It pulls their tongue away from the back of their throat and opens up the airway.
All right, let's shift gears and focus on infant CPR. This is for babies under 1 year old, and their little bodies are so fragile that they require a completely different approach.
So this is the best way to do it for an infant. It's called the 2-thumb encircling technique. You literally wrap your hands around the infant's torso and you use your 2 thumbs side by side right in the center of their chest just below the nipple line. This gives you really stable and effective compressions.
Now, if for some reason you can't get your hands all the way around the infant's chest, there's a plan B. You can use 2 fingers from one hand. You put them in the exact same spot, center of the chest, below the nipple line, and you just push straight down.
Hey, look familiar? The rate is exactly the same as for a child, 100 to 120 compressions per minute. That beat for staying alive is universal when it comes to CPR. Keeping that rate consistent makes it one less thing you have to struggle to remember in a super stressful situation.
But here's another huge difference. For an infant, the compression depth is much shallower, only about 1.5 inches. A good rule of thumb is that it's about 1/3 the depth of the infant's chest. And again, what's our rule? You have to let that chest come all the way back up after every single compression.
Okay, this is a really critical point. To open an infant's airway, you do not tilt the head back very far at all. You just want to keep it in a neutral position, sometimes called the sniffing position, as if they're just sniffing the air. If you tilt an infant's head back too far, their airway is so small and flexible that you can actually pinch it shut.
So, you're doing it. You're performing CPR, the adrenaline is pumping. But when do you stop? Knowing when to stop is just as important as knowing how to start.
You keep going until one of these things happens. You see an obvious sign of life, like they start breathing on their own, an AED shows up and is ready to use, another trained person arrives and can take over for you, the paramedics get there, the scene becomes unsafe for you, or, and this is important, you become too physically exhausted to continue safely.
Now, I need everyone to pay close attention to this slide, because this is a huge exception to the rule. If you are all alone and you find an unresponsive infant, you do 2 minutes of CPR first, and then you call 911. Why? Because for infants, cardiac arrest is almost always caused by a breathing problem, which means immediate CPR is the single best thing you can do for them. Everything we've covered here is an absolutely crucial foundation that could genuinely help you save a life. But watching this is not a substitute for proper hands-on training. I really encourage you to find a certification course from a place like the American Red Cross or the American Heart Association to actually practice these skills and build that muscle memory.
So that leaves us with this one question. You have the knowledge now. You are more prepared than you were just a few minutes ago. So, are you ready to be the one who steps up, the one who acts, the one who can make all the difference in the world?